Well, thank you very much for joining us here on PM Express. After 2 nights on PM Express of heavy focus on Parliament and all the chaos that has unfolded since last week Friday, let's take a break and let's focus on a clear and pressing danger that indeed is a matter of life and death. Because after the parliamentarians, there will continue to be MPs and politicians, and the issues that we've discussed since Monday haven't ceased. The budget has, of course, still been approved. And so business as usual is about to ensue. But let's focus on a big conversation, a conversation that can affect your life very directly. It can mean you are possibly, unfortunately, losing your breath or surviving. Omicron, I'm pretty sure you've heard it. We having a conversation about averting a fourth COVID wave. Why? Because today, there was a major announcement. There's a detection of this variant here in Ghana. It was detected at our international airport, Kotoka, in travelers from Nigeria and South Africa. So this is a major subject. But how big a deal is this? I'll tell you something very shortly that some say will calm a bit of nerves. But as far as the many countries where this has been, and this is the latest variant of the virus. The most deadly before this, the most scariest of all, was the Delta. And this is still being studied across the world. But so far, you have it in the African countries on the Omicron red list. For a lot of the countries, South Africa is definitely the key one to watch. Zambia, Mozambique, Zimbabwe, Malawi, Botswana, Namibia, Lesotho, Eswatini. These are one of the 10 countries from Africa. If you go anywhere, like in the UK, they did initially when the Omicron emerged, took really stringent measures, but have relaxed it today because a bit more of clarity is beginning to emerge about this particular variant. We'll learn a bit more. We'll learn a bit more tonight. If you go to Germany, it's triggered some radical measures already being put in place because the airlines are only allowed to fly back German citizens and those residing in Germany from these eight countries. And so this is key. Everybody else is taking some measure because of this. The UK has resumed flights now, connecting to South Africa after temporary halt due to the Omicron variant. Because when it just first emerged, especially in the UK, the thinking was that it is South Africa. But then they did a bit more sequencing and testing. They found that there are, cases in the UK with no links to South Africa or the countries that they're put on the red list. And in fact, it's been in other countries way before South Africa in Europe, before South Africa detected it. So that's a key thing. Also, passengers returning from South Africa and neighboring countries are made to face mandatory hotel quarantine for 10 days at their own expense. Now, if you look at Switzerland, they're also taking their own measures. For example, they have significantly tightened travel restrictions. Regular flights from South Africa and 6 other countries have been suspended indefinitely. Now, the key thing, though, to observe, which we need to ask tonight, all these countries are taking all these drastic measures, and these are countries with far stronger health systems. What is Ghana's response to the Omicron detection in African countries? Because if you go back to the cases that we've detected in Ghana, as I've indicated, one of them came from South Africa. I mean, how tough are we at our borders, at the airport, for example? Because other countries are doing a bit more radical measures. And so should we be following suit with our own radical measures? So what is the WHO saying about this? They say it's not yet clear, and this is a fact, not yet clear whether the Omicron is more transmissible compared to other variants, including the Delta, because a lot more work needs to happen on this. They have, though, affirmed that vaccines remain critical. So don't believe the stories that say, the vaccines aren't working against Omicron. It's better to be vaccinated than not, because you definitely have the protection, some of it at least, to do with this. But this is what really cheers me up. We heard this today from the WHO, and they say that according to the official of the WHO who spoke today, we believe, early indications suggest most Omicron coronavirus cases are mild. Okay, so this is key. This is absolutely key. And that's why the vaccines are absolutely important for all of us. Now, for Ghana specific, the question is, what does this mean for Ghana? We know that these are the many tips that we've experienced in terms of the waves over the last, many months since COVID hit our shores. And if you look at the first wave, which was in 2020, in June thereabout, that is the first wave that climbed pretty high. 10K total coronavirus infected cases. That was the first one. Then we had a second one this year, somewhere in March. And then there was a third wave that was also predicted that we saw. And if you draw a line here, you see that the waves that we've had waves, but it's been tailing off. It is in the downward trajectory in terms of the waves that we've had. There's a fear, though, that Omicron may tip us to a fourth wave, and this is what Ghana needs to avoid. And there's been a lot of talk about what Ghana is doing to avert this. Indeed, Christmas is coming, and so this is a big talk. One of the things we're going to do tonight is some of the stringent measures. Now, the Ghana Health Service is introducing the COVID vaccination passes for selected places that without them, you may not have access, right? And we're going to be speaking to some of those affected about how they're going to enforce this and what you need to do. And again, if you look at the vaccination is going on. Now we have a lot of vaccines in the system, right, so far. So this is key. Over 9 million vaccines are currently available in Ghana for use. Get yours. Very important. It has assured Ghanaians that all protocols have been intensified. This is what we're going to be talking about. It's absolutely important. This is 1st of December. December is approaching, holidays, but we have Omicron. I mean, the day they chose to announce their arrival is very instructive. The first day of the month of Christmas is when we got to know about this. What does it mean for you? Stay with me after the break. My guest will get into it. And thank you very much for staying with us. My guest joining me via Zoom tonight, Dr. Aboagye Da Costa with the Ghana Health Service. He is the Director of Health Promotion and lead of the COVID-19 risk communication at the Ghana Health Service. Thank you very much, Doc, for your time. Of course, also joining us is a man not a stranger to the show. Dr. Yaw Bediako is my guest. He is immunologist, West African Center for Cell Biology of Infectious Pathogens, University of Ghana. And of course, when it comes to sequencing, they take the lead. And I'm pretty certain they may have spotted the Omicron in Ghana. He's my guest tonight. We'll be speaking to some of the groups, taxed with implementing or maybe affected by the measures that the Ghana Health Service has introduced, particularly the one relating to the COVID passes, the COVID vaccine passes that you need to show before you access these services, mainly in the hospitality industry, but also affecting public transport as well. We'll get to speak to Dr. Edward Aka Nyamike, who is the president of the Ghana Hotels Association, about how they're going to enforce this. And then we'll also hear from the GPLTU's Abbas Imoro, who is the head of communications at GPLTU. I mean, that's going to be a big challenge for them. We want to get into how they're working with the health authorities to make this work. But I want to start first with Dr. Aboagye Da Costa, who joins us via Zoom. Doc, great to have you join us. The fact that we have now confirmed Omicron in Ghana, does it change anything about our strategy?
Thank you, Evans. Can you hear me?
Yes, I can, loud and clear.
I think in terms of strategy, the airport samples that we took. We will continue to enhance our surveillance, as was said by the...
Well, apologies.
Can you hear me?
Yeah, we lost you briefly. Please just restart. We're going to continue the enhancing the surveillance is what you said before I lost you.
Okay, so I'm saying that detected this Omicron from a... So now what we have to do is to enhance our community surveillance and others to make sure that obviously look at the extent if it is really in the country, that is at the community level or not. And that work, I think it will be done by Wabik and Noguchi. Now, it also shows you that our support has served the country very well. Now, we are saying that when you are coming to our country, you need a 72-hour PCR test. That will be in place. We are also saying that when you get to the we'll test you. That's the antigen test. And should we find you to be positive, we'll put you into isolation. And on the third day, we will do a PCR test, of which we will do a genomic sequencing as well. So this is what means that the testing regime at the airport is very robust. And we haven't changed anything. It remains same. Yes.
Okay, I want you to just, for clarity and emphasis, there was an announcement by the health minister about a raft of new measures that you're going to be implementing within the next month, including the COVID vaccine certificates that you require to access certain services. Kindly go over that for me. What exactly is it, and what are the time frames? The time frame for this? Which services precisely will be affected?
Okay, thank you, Evans. So we are declaring December as a vaccination month, of which the health minister launched today. Now this gives us a 4 weeks window to and also put in place measures that will enhance the enforcement of these restrictions that we want it to start immediately after the campaign. Now, the fact of the matter is, during the initial stages of the vaccination exercise, we gave priority to certain groups, like health workers, like security officials, like all the three arms of government, like the elderly, like people with underlying conditions. Vaccines that we have now, currently, we have brought in 12.3 million doses of the vaccines. So in the last 4 weeks, we have had about 4 million. So this tells us that we certainly have more vaccines. And I also know that there is about 8 million in the pipeline, as the minister said today. And all we need is for the Ghanaian people to a variant and Christmas and other activities. We are proposing that certain groups, after we have ended this campaign, will need vaccination, a proof of vaccination before they enter certain public places. And we have said that drivers, commercial drivers, we have said that our healthcare professionals, we have said that our security, our security officers, we have said that we will engage further with the executive and the three arms of government to see if they will also be, obviously, if within their place of work, they can enforce this. For our health workers, for example, we've given them enough opportunity. Like in the first category, we prioritize them as vulnerable, so we gave them, so they have up to the 31st of December to get their jabs. Other than that, we will obviously instruct our heads of the various health facilities to enforce these protocols on them. This is it, okay?
Yes.
Can you hear me?
Yes. I can hear you, yes.
Yes. So there will be a lot of engagement. Now, we have started. So the Ghana Football Association, for example, came out to say that, they wanted to start before the premiership. We'll continue to engage them to see when they can start after the campaign. We've also engaged the Ministry of Tourism and the Tourism Authority. So they've also issued a statement to say that if you are going to restaurants and other places, you would need, obviously, your vaccination verification certificate. But let me say that we'll do this within the framework of the law. So the president still chairs the COVID-19 task force. So we were engaged to make sure that all things. This is why the health minister said that the dates actually will be announced, because we really need to do the engagements. So I think my population is, yes, we have enough vaccines in stock. We have a decentralized system. We have a decentralized health system where all our regional health directorates, our district health directorates have centers, have set all our health facilities. One thing that we are also, so we are doing house to house. We are going to churches. We are doing lorry parks and markets. So, if, for example, a group wants us to come and vaccinate them, or then they will come there and vaccinate them. Today, during our program, we set up a vaccination center where we were inoculating people. So that's going to be our approach over the next month. So I think we are giving people opportunity to vaccinate. But we are also saying that, if you do not comply with this, then you may have to PCR test before you either go to work.
I'm sorry, Mr. Da Costa. I'm having a challenge with the line. We're having a few breaks. Let's see if we can get you on a better connection, so we can hear it, continuously. Because you're about to say something that's very, very important about, if you don't take advantage, then what happens? You may not have to. You cannot go to work until you have a PCR test. I want people to understand that, because that is so critical. So we'll try and rectify that briefly and have him back on so we can hear him properly. But let me bring in Dr. Da Costa into this. Doc, so far, in terms of the measures that we just heard, they are outlined by the Ghana Health Service in the context of Omicron. I'll come to Omicron shortly and how we detected it and what this means. But what do you make of the measures?
So you said Dr. Da Costa.
Sorry. Dr. Bediako, yes.
Sure. No, thank you for having me. I think the measures that have been put in place are adequate. I think our airport testing continues to prove to be a useful measure. The fact that, samples, individuals who come in can be detected as antigen positive at the airport. And then subsequently, those samples are now being sequenced to determine what variants individuals are presenting with. I think that is useful. It is not completely foolproof. We have always said that there's always a risk that a few people will slip through the cracks. But I think, coupled with the fact that individuals are required to have a PCR test not more than 72 hours before they travel, the net is as tight as you can have it without significantly impacting travel into the country or out of the country, which of course can have economic ramifications. So I think the airport testing is extremely useful. And I think where we perhaps need to do better as a country is continue to adhere to the protocols. I think now we can all agree that mask wearing is at an all-time low. Personal hygiene, the hygiene protocols do not appear to be followed as strictly. You see large groups of people having, gatherings and so on. So I think that is where we are, unfortunately, maybe letting down our guard to some extent. And with the holiday season approaching, we have to remember what happened last year. So I think the airport testing is a good measure. And I think as far as the guidelines that continue to be in place, those are great guidelines. But of course, it is the adherence that I think as everyday Ghanaians we can do better.
Let me ask
and
you.
then finally,
yeah, go on, please, Dan.
I was just going to say, and finally, unlike last year, one thing we have to remember is last year we did not have the luxury of vaccines. Last year we were talking about Christmas, and we're talking about the airport, and we're talking about COVID hygiene protocols, but we did not have any vaccines. Now we have vaccines, and we have enough vaccines in this country right now to vaccinate a good number of people. So I think those who have not yet been vaccinated should avail themselves. I think that is another area that ordinary people can take the responsibility or take their destiny into their own hands. If you're not already vaccinated, to get vaccinated, because to be honest, all the protocols and all the testing are preventative measures, but the best bets we have against minimizing death from COVID-19 is vaccination. And all the evidence currently available suggests that these vaccines will hopefully maintain relatively good efficacy even against Omicron. So if you're worried about Omicron, the best thing to do is to get the vaccine. And I think that is an area that needs to continue to be pushed. And I'm happy to hear that the government is trying to encourage people. And at some point, you may need to take stiffer measures as are being discussed for next year.
Yeah, I mean, I just started by laying out what other countries in Europe mainly have done, the stringent measures at the airports, red list countries, etc. Preventing when you're coming from a particular red list, what you do, it's regardless of your PCR result, you have to. Should Ghana consider such measures at the ports, especially with December, when a lot of people are going to come into the country for the holidays from elsewhere?
I don't think we need to do travel bans or red listing. I mean, if you even look at the countries that are doing red listing, there's no logic to it. You ban South Africa, but you don't ban Belgium, and they have both reported cases. So I think there is a clear inequity in how these bans have been applied. I think there's been a lot of criticism in the international media about the seemingly racist application of red listing or bans. I mean, South Africa has been unduly penalized for being the country that Omicron did not emerge in South Africa. They just found it first because they have very sophisticated sequencing and surveillance system. It actually appears as though now there's evidence that a couple of European countries had actually detected it sooner, but had kept quiet. And then South Africa does the right thing, reports to the WHO, and then they paid a price. The fact that the UK has now reversed their decision shows that it was not based on science. If it was based on science, you wouldn't reverse it so quickly. So I think what Ghana is doing by saying we are going to continue to maybe even stiffen a little bit our surveillance at the airport, make sure that everybody who comes in has a PCR test and has this antigen test done at the airport, I think is the best we can do. Red listing, you can never completely stop the virus, and you have to balance, a lot of factors when you are thinking of what measures to take. I think doing anything more than what we are currently doing will be counterproductive and would not necessarily provide any further protection. Okay. As I said, the best things we can do are the measures in place at the airport, but then internally as a country, enhancing our defenses by pushing immunization. Because you can build a wall if you want, but if people in the country are not immunized, the virus will find a way to sneak in and then can infect people. But if you have large numbers of people immunized in the country, that wall is now impregnable, because even if they were to get infected, they would have mild cases and they would not die. The fact that we are saying that Omicron cases are largely mild, let's remember that the majority of places that have reported these, at least outside of Africa, are places where they have relatively good levels of vaccination. So it's possible that the people who are getting infected with Omicron have been vaccinated. And so that's why we are seeing mild. So the more vaccines we roll out, the less we have to worry. Even if you were to get infected with Omicron, the chances are you would not know it, or it would be very mild, and you'd go back to your everyday life. So I think that's what we really need to focus on, not worrying about stopping people from coming to Ghana, but worrying about making sure people in Ghana are vaccinated. Yeah, I mean, I'll come to the central question about, now that we've detected it here, the question about community spread of it, and how do you deal with that, and the role of WAPIC in this, the sequencing, making sure that what we reported is what it is, and if it's the community, what responses do we
deploy for that. Is Dr. Da Costa with me? Because, okay, he's back.
Yes.
Doc, great to have you back. There was something you're about to say about once this intense period of 1 month is exhausted, the measures are going to be tightened and you will need the passes to access places. And if you don't show, you probably need PCR testing. I think you were about to explain that when we lost you. Please wrap that up for me because that's so key.
Okay, thank you so much. So we really want to be fair and we really want to give everyone the opportunity so that rights are also respected. And if you look at what other countries are doing, in fact, for some countries, you have to test daily before you go to work. So we are saying that, we have enough vaccines, people should go for the jabs. We are chasing people with the vaccines. We have made the vaccines available. But should you fail to do this, then maybe you must show an alternative, which is a PCR test before you come to work, or a PCR test before you come to, and that will be at your cost. So because we are all not safe until everyone is vaccinated. And let me at this stage commend the government for the effort that they are making to bring in the vaccines, because in spite of all the challenges, the supply chain challenges, if we have this enormous amount of vaccines in town, then it means that a lot of work has actually gone in. And like the minister said, in fact, Ghana was the first country to receive the COVAX facility. And if we tell you the amount of work that we put in, Evans, you'll be amazed. So I think the Ghanaian people should be with us, and obviously, let's carry them along. But Dr. Bidiakun says something very important, and let me emphasize that. I think one of our defenses have also been the face masks. And you see, I think it is at all time very low. And we really want people to go back to the basics and start wearing their face masks. Where possible, do your social distancing. The washing of hands still remain very important. All the safety protocols are very good. So we shouldn't really abandon them. We should continue to follow them for us to avert a possible fourth wave.
Let me ask you to clarify for me, the PCR testing, when you talk about the workers, having to show that before they come to work, you're referring to public sector workers, or every worker? What category of workers may have to do this if they don't vaccinate? And we have to emphasize: vaccinate first, take advantage. If you don't, then you have to go to next. Which workers are these that may be affected if they don't get a vaccination?
Okay, so let me say that what we put out today is proposed government workers.
Okay.
Now, bear in mind, I've told you that we have to work out the modalities because we have to respect people's rights. So we'll be working with, for example, the Public Services Commission. We will be working with the presidency to see whether it can be within the Impositions Act, whether it can be. But bear in mind, we do have the Public Health Act as well. This is what the Minister of Health talked about. So we'll be exploring all this within the 4 weeks. Then we come up with firm restrictions. So we are not there yet. We are now trying to put the modalities, but we have to prepare the Ghanaian population that this is what we intend to do. Then the stakeholder engagement programs will kick in, one of which is what we did today. So we'll be engaging the transport unions through the transport minister. The chieftaincy affairs minister was there today. The government chair's representative, the chief imam, the clergy, they were all there. So we will engage further to make sure that we have obviously done our work very well before we kick in these measures. But we believe that, for example, if you take your station, for example, we believe that your management should be able to take a decision whether your workers will need obviously to be vaccinated before they come to work. And for the public good, we will be advising you on why it is important for you to do that, because you are a private organization. So we will extend the CSOs will be involved, the NGOs will be involved. It will be a broad stakeholder consultation.
Yeah, I mean, very interesting there. Thankfully, we have the GPLTU with us, and so I want to go to them now, and I also hear from Dr. Edward Aka Nyameke, who's also joining us, because now let's shift the conversation. We've had the health experts. I'll come back to Dr. Bedi Akusho because I really need to explore this community spread question. Abasi Moro, thank you for joining me. Abasi Moro is the head of communications with the GPRTU. Mr. Moro, kindly unmute for me with your Zoom.
Yeah, is it okay?
It is loud and clear. Thank you very much, Mr. Moro. We just heard that the Ghana Health Service officials say that, I mean, well, it has been announced already that after the expiration of this 1 month period, yourselves and your colleagues, drivers, you would need that vaccination certificate to actually do your jobs. There's going to be consultations a bit more. First of all, what's the GPLTU's reaction to that?
Good evening to listeners. I think if they just come up and say you need your vaccination card to work, I don't believe that is enough, because this COVID came, and when they started the vaccination in Europe, we were all looking for this vaccine here. And it wasn't easy to have it here. And later we heard about so many complications about this COVID vaccine. Now the vaccine, we are told the vaccine is here. Yes, some of us, we are fortunate, we've taken. I had privilege to take the Johnson & Johnson, which is just one shot. I and other colleagues have privilege to take that. But they need to convince people to go in for the vaccine by telling people, if you don't have the vaccine card from next year, you won't work. I mean, that is not enough, because after all, that will not put food on the table. But since we are Ghanaians, because drivers, for instance, we could easily contract this disease due to a number of people we deal with daily. So there is the need of us to convince our drivers so that they'll go in for this vaccine. By just coming up and telling people, if you don't have the vaccine early next year onwards, it won't work, I don't think that is the right way of, the right approach to make sure everybody go in for the vaccine. Yes, they should strategize and come up with something which will attract people, which will make people to understand that, yes, there is a need for you to go in for the vaccine. After all, this vaccine is free. You need to protect yourself and protect others. In the business that we are doing, we have a lot to do. We have to make sure we talk a lot. We have to convince the people, our drivers in particular, to understand that, yes, you need to protect yourself and protect others. So they should change the strategy in which they are. You can't force people to take this vaccine, but you have to, talk to them to get that understanding.
Mr. Moro, so we just had the Ghana Health Service official explain that over the next 1 month, they've declared it today, there was a major ceremony. It is a vaccination month, a month of vaccination. So they are giving the driver unions an opportunity, your members, to go and get vaccinated, so that when they finally introduce these measures with showing your vaccination cards, your members don't get affected. Don't you think that is a good strategy, at least a 1 month period? Make sure the drivers' unions and all your members are all vaccinated. You get your card so that you can work in an environment that you keep yourself safe and your passengers as well.
Yes, it is. But all I'm saying is they need to talk in a polite way. They need to make sure they are able to come, because as we speak now, there has been a speculation of some of this vaccine, and after having the vaccine, there are some complications after having the vaccine. They should make sure they clear the minds of Ghanaians on that. Because so many people say, we've heard, if you take the vaccine, you will contract certain diseases, etc., etc. So they need to work a lot, because this COVID issue, they started nicely and it dies off. Nobody talks about COVID the way they started it. So if today the vaccines, they have a lot of vaccines and they want everybody to immunize, they have to know how to talk to people. Else they will bring the vaccine out and nobody will go in for it.
Okay, so
they should also strategize and make sure they bring it to our doorsteps.
Okay.
They bring it to the stations whereby the driver, after working, he or she could just get to the vaccine center and take that shot.
Okay. I mean, so interesting. Stay with me, Mr. Emoro. Let me bring in Dr. Edward Akanyamike, the president of the Ghana Hotels Association. Dr. Akanyamike, thank you also for joining me. The hospitality industry is also, of course, going to be one of those industries that would require the vaccine certificates, as has been mentioned, after this period. How is your industry viewing these measures that may be introduced down the line, as has been announced already by the health minister?
Well, Stevens, thanks so much for the opportunity. Let me start by saying I think Dr. Aboji Da Costa has addressed some of the apprehensions that we had, or let me say the concerns we had with his statement about being fair to the public by providing all the opportunities for people to vaccinate. And once that opportunity has been given, then they can enforce the proof of vaccination before entering into events. Because the challenge we had initially was the announcement by the Deputy Minister for Tourism, Arts and Culture that patrons attending events during the Xmas season will be required to show proof of their vaccination before they enter those events. Now, that was clearly delinked from what the Minister of Health is saying now with regards to the education of the public and all that. So that disconnect created that apprehension, because if you have not given that opportunity for people to vaccinate, then how are you going to enforce that? So long as that opportunity is given, and don't forget that there's a clear, good balance between the health, our health, and, of course, our livelihood. We are there to make money, to make profit, but then we have to balance it with the need for the public good in terms of health. So if that opportunity is given, then we will surely abide by that enforcement if we should get to that point. And let me also add that, the hotels, from where I operate, we have a more controlled environment, and we are able to apply all the protocols that are advised for us to take. So we don't really have that much headache in that direction. If the health professionals advise, or the country advise that that is the way to go to control the virus, we are ready to abide by it, because we need to stay alive to be able to have our business flow as well. So I'm glad that Dr. Aboji Da Costa has cleared the air, and we are okay with it, so long as the opportunity is given. Remember that the Minister for Finance announced in the 2021 budget that we were going to hit the herd immunity by the end of 2021. It looks like they are getting closer and closer to it, so they should fasten the process, and then we will also abide by it once it is done.
I mean, Doc, stay with me. Thank you very much for this. Let me quickly go to Dr. Bediako. Doc, there's a point that the Imoro Abbas, where the GPLT made about the vaccines, very critical. He's pointing to the vaccine hesitancy among drivers. And he's saying that the strategy should include convincing people because of all the myths around it. So people are not taking before you enforce. I mean, you listen to him. How do you address that, for example? How do you address a concern that he raised?
I mean, I think vaccine hesitancy is proving to be something all over the world that, scientific community, public health officials, governments are struggling with combating vaccine hesitancy. I mean, you talk about countries like Austria or Germany, where they have enough vaccines to vaccinate probably the whole country 3 times over, and yet they only hit maybe 60% vaccination because people are hesitant. So hesitancy is not just a Ghanaian problem. I think as scientists and as health officials, we are challenged with how to communicate certain things. Certain things may appear obvious to some of us, but people have different concerns. And I believe the way you try to go about it is not to rubbish somebody's opinion or to insult somebody as being foolish or stupid, but to try to understand where they are coming from and then try to address that. There's a lot of fake news. There's a lot of misinformation that unfortunately people are exposed through mostly social media. And that appears to be seeping into Ghana. So there's no easy way, there's no silver bullet, but I think we have to just continue the engagement. We have to present evidence where we have it of how effective these vaccines are. And we have to help people to realize the consequences or the potential health consequences of not being vaccinated. I mean, from a scientific side, local scientists like myself, we are working to try to generate data, local data, because oftentimes we are told the data you have is from somewhere else. How do we know it's the same? So we are working very hard, partnering with the Ghana Health Service to collect data, to run research studies, to demonstrate the efficacy and how these vaccines are working in our communities. Hopefully, as we get more of such data, it can be presented to people, in an easily digestible format to help them to see that these vaccines are effective and are important. So it requires patience on our side, but it also requires an open-mindedness and a lack of cynicism, perhaps, on the public side. The Ghana Health Service is not trying to fool anybody. The Ministry of Health is not trying to fool anybody. I think we have to move away from the conspiracy theories. We are just trying to save people's lives. The president early on, he gave a famous speech where he said, we know how to resurrect the economy, but we don't know how to resurrect people's lives. That remains true. The president cannot bring back somebody from the dead. And so everything that is being done is to try to protect people. And I think, we just need to continue to encourage people, continue to present evidence. And I believe that Ghanaians in general, we are reasonable, intelligent people will begin to see. But we have to meet them. You cannot just, I think the GPRTU spokesman said, we cannot be insulting people and we have to be polite and we cannot be rude. And I think that is part of it. We cannot assume that because I have a PhD that I am better than somebody else. So we have to meet people where they are and do our best, because this is for everybody's survival. The world is not safe till everybody is safe. Ghana is not safe till everybody in Ghana is safe. And so we just have to keep at it and not give up.
Dr. Costa, you heard the GPLTU's concerns. What do you say to them? Yes. And one of the things he says is, set the vaccination centers up at the lorry stations, at the terminals, and let's get it. What do you say to the concerns that you had?
Thank you, Evans. I think it's exactly what we'll be doing within this 4-week period. We'll be at the STC, the VIP, the various stations. We will be there. Our centers will be there so that they will also have the opportunity to be vaccinated. But let me address something about the hesitancy a little bit. I think, yes, we recognize that for the Ghanaian hesitancy, we have the research data. It's the wait and see approach. Even if you ask people why you're not taking it, but it's like they are just waiting to see what will happen to others before they are able to take it. So I think it can easily be addressed through education. But what we have done is that we have set up what we call the misinformation task force to pick some of these fake names, to pick some of these rumors on social media, electronic, everywhere, so that we are able to carve our messages in such a way that we address them. And we do have a dashboard that we monitor this, and we have staff volunteers doing this. And we also have a call center that addresses people's concern when they have issues. So I think we'll take it on board, as the GPRTU head of communication said, and engage them and set up centers. But not only there, we'll be setting up centers across places where we think that people people meet, like, for example, sports stadia, during occasions like functions, even funerals, we will be doing that. So we are not talking about the funeral, but we'll be doing that because we've been going to churches anyway. So we know the period that we are in, and we will not relent.
Okay. Ms. Abbas, you've heard the assurances from the Ghana Health Service and the health expert there. Does it address the concerns, the approach that they're about to take this month? Oh, okay. We don't. Okay. I want to take a quick break. When I return, I'll get the final thoughts of Dr. Nyamike there on the hotels and the hospitality industry generally. I just want to get a sense of what this Omicron means for them. They have been doing a lot. In fact, if you go to any hotel now, it's standard. They have their, the washing your hands. They really provide all the facilities. This is the month that they also hope to sort of recoup a lot of what they've lost. I wonder what the strategy is from their side. And then we'll end by talking about the community spreading, which is a big deal now with Omicron. Stay with me. I can see here on PM Express. Dr. Nyamike, let me ask you, I mean, with Omicron now in and December here, big month for you where business should be booming, is there any change in strategy? Is there any enhancement of what the hotels and your members in the hospitality industry are already doing?
So I wouldn't say there has been a significant change in the measures we put in place right from the beginning of the pandemic. It's been quite consistent, especially with the supervision of the Ghana Tourism Authority. So, like you already said, you go to a lot of the hotels and you have to go through the protocols as advised by the Ghana Tourism Authority. So what we hope will not happen is a fear and panic that this whole Omicron variant will cause if the health service does not handle it with that care that they need to. So we will pray that they will handle the education in a manner that will not cause any fear and panic. And we are also happy that the Ministry of Tourism, Arts and Culture and the Ghana Tourism Authority launched the December in GH. I'm sure you are aware that a lot of events will take place during December, which will, of course, get about 150,000 people, by their estimation, into the country. And also within the country, people are going to move around a lot. So I'm sure the hotels will continue to do what they are doing because, as indicated by Dr. Bediakon, the use of the hand sanitizers, nose masks, social distancing, and all that are still important, and the hotels are really, really doing that. So we are well positioned. We are well positioned to ensure that we play our role in this whole fight against the virus.
I mean, Doc, I'm grateful. Dr. Bediako, I wanted to do a 30 quick minutes on the community spread. I mean, I guess what it is that it really looks like impossible to tame it completely, except to enforce the vaccines and the regular protocols that we already do. In 30 seconds, what would you say to everybody else who's worried? Okay. Unfortunately, I'm not sure why he didn't hear me. But listen, this is a conversation. Most importantly, if you didn't listen to anything, 1 month, 6 million vaccines. Go get yours now before the government begins to crack the whip. Enjoy the rest of the evening.